In this country, healthcare is out of control, the cost.
We were in a no-win situation when we'd come to the bargaining table.
And it's been this constant erosion over the years of just slight tweaks that have been costing our members benefits.
We were getting less and less and less for our dollar.
And we knew that eventually we were going to price ourselves right out of benefits for our employees.
It was at that point when we started looking for a long-term solution for the industry. And that's when we, partnered up with America's Agenda to look for solutions.
The thing I like about the model that's been put together with America's Agenda and UFCW is the fact that the benefit design facilitates access to primary care services.
Es mejor, ha mejorado mucho en cuanto a la rapidez de la atención. No necesitamos tomar tanto tiempo si tenemos una necesidad médica. Solo llamamos por teléfono y nos dan el appointment que serán, tal vez de un día para otro. Entonces, ha mejorado mucho.
We're actually asking our physicians to be compensated in a different manner, but to also have a set of expectations that most primary care providers love. They love the idea of being able to spend time with patients. They have no problem with the concept of being accessible to patients remotely through email or video or telephone. And in fact, most doctors that practice in this model actually have better professional satisfaction. Primary care delivered appropriately, where physicians are incentivized to operate at the highest level of their capability, is the key to fixing what is a problem in healthcare in this country today, which is cost.
This feels like more of a personal care because the doctor gets to know you on a first name basis. I mean, this guy gets to know your family, your wife, your kids. All your prescriptions are free. You don't have to pay for nothing. No out-of-pocket costs at all to any member.
These people now can go to the clinic where they normally would have taken that family member to the emergency care. They can go to the clinic and there's no charge.
Porque antes no temíamos, ¿verdad?, de ir al doctor porque teníamos que pagar el copay. Hoy no, hoy es muy fácil y se siente uno más a gusto y como muy libre de que no tienes que pagar el copago que se pagan los $25 o $35.
Blood drawn for blood tests. If they have an on-site lab, their lab work is free. If they have X-ray equipment available, that's free.
I haven't had a doctor bill in probably close to 3 years now.
In the first 3 months, it was just under $1 million our employees saved by utilizing the clinics.
Not only did we get contracts with the healthcare model we wanted, but we got the largest wage increases that we've negotiated in this industry in years because they projected these savings, and that freed up money in the budget to actually give workers what they deserved. So it makes a difference to be able to negotiate a model that we know, both sides know, is projected to save us money.
I felt from the get-go that this was probably one of the biggest innovations in the delivery of healthcare in this country, period, but let alone in our industry. If it wasn't for America's Agenda, we wouldn't have known about this solution.